Elementary school kids are one step closer to getting the COVID vaccine. An FDA committee voting in favor of the Pfizer shot for ages 5 to 11. They say it's safe and it's effective. The shot still needs full approval. Local vaccine providers say the earliest kids could get the shot here in Charlotte would be next Tuesday. And this morning we heard from Atrium health officials about the potential rollout.
So we know that the vaccines will be allotted from the state to the counties, and then they will arrive in the counties and then be distributed. And I have no doubt that they're going to be distributed equitably. There's no reason they wouldn't be. We just don't have all the details yet. But Atrium has already been meeting. We've been meeting with all the practice managers and people responsible for vaccine events, et cetera. Yes, events are planned, and you will be able to sign your child up.
Atrium says it's waiting on full approval before releasing info on any vaccine events. Meanwhile, for more on the next steps for approval, we send it over to Washington and NBC's Chris Pallone.
COVID vaccines for young children, one step closer to reality.
This concludes the vote.
An FDA advisory panel voting 17-0 to recommend that the Pfizer vaccine be made available to children 5 to 11. The drug maker says it's more than 90% effective at preventing symptomatic infection in that age group. Good news for parents like Jill Howard.
I think anything to keep our kids safer. I wish that my 2-year-old could get it as well.
But in a recent study, 6 in 10 parents said they'd wait and see or won't vaccinate their children at all.
I'm not opposed to vaccines. It's just that it's just so new. And, we don't know what the long-term effects are yet.
FDA panelists wrestled with those issues too, but concluded the benefits of vaccinating the nearly 30 million children in this age group outweighs any risks.
Sadly, more than 700 children have died of COVID since this pandemic began. Kids can also get the long COVID consequences, even though they might not have a severe case. It turns out some of them just don't seem to recover.
Nationally, new COVID infections have plunged 60% since the recent September peak. But with cold weather and holiday travel approaching, health officials aren't letting their guard down. The CDC has 2 days of meetings planned for next Tuesday and Wednesday. If the CDC director ultimately signs off on this, children ages 5 through 11 could start getting vaccinations by late next week. In Washington, Chris Pallone, NBC News.